Myofascial releases for headaches and neck pain. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Welcome to this Ed Talk today. I want to show you 2 ways at home that you can relieve neck pain and headaches or migraines. 2 simple things that you can use, very little equipment at home in order to help yourself feel better. The first thing I'm going to show you is a release for the front of your neck, and you're just going to need your hands, okay? Why would we want to release the front of our neck if you're having neck pain or possibly headaches? A lot of times people think if their neck is hurting, usually hurts in the backside. So they're doing things like stretches and trying to get better mobility from the back because that's where their pain is. However, I'm going to encourage you to look from the front side. Why? Well, so many people that I find in my practice here at the Healing Spot, they're tight in the front of their shoulders. They're tight in the front of their neck. I'd like to show you a quick test just to find out exactly how tight you are in the front of your head and neck. What you're going to need for this is just some wall space or the back of a door. So let's move there. Okay, now we're next to a wall or the back of the door. You just need some free space. What you're going to do is stand about 1 or 2 inches with your heels away from the wall. And you're going to lean up against the wall, and I want you to have your, like the top of your butt up against the wall. And you're going to see if you can put hands on the wall into a low V position, and you want your shoulder blades and the back of your head on the wall. So go ahead and try that. What I find with some of my patients is they're actually like this. They're like, I'm trying to get my head there, but they have space. They cannot get the back of their head to the wall. Or you might even notice that your shoulders are kind of hunched forward. It might be hard to get your arms back and shoulder blades at the same time. So just kind of see if you can be in this nice upright position and if you're able to be next to the wall like this. If it's causing you a lot of strain, or if you find that you are tight, you're going to really like what I have to show you next. For this first release, all you're going to need is your hands. Now, you can do this sitting on the floor like I am, or you can do this in a chair. It doesn't really matter. Okay, what we're going to be doing is really releasing the front of the neck. So what you're going to do is you want to have a shirt that you can be a little exposed here, so that way you can put your hands directly on your skin. You don't want to be on clothing if you can. So what you're going to do is you're going to come down just below your collarbones, and you're going to place one hand here, okay? And then you're going to place the other hand on top. So I'm just stacking my hands. And what I'm going to do here is just press in gently in towards my sternum. And that just helps me to kind of anchor down my muscles and my skin, okay? And what I'm going to do now is I'm going to lengthen through the top of my head just slightly, like I have a string pulling me up. And then what I'm going to do is I'm going to start to look up towards the ceiling, or where the ceiling and the wall meet. Okay? And what you're going to feel with this, you're looking straight up, is you're going to start to feel some opening and maybe stretch or even tension underneath your jaw and into the front of your neck. Okay? Now, it's hard for me to talk and show you at the same time, but what I want you to do is just go enough where you can feel a slight, maybe medium to moderate stretch. And then you're going to wait and hold. So your arms or your hands are anchoring down as you're lifting up and out. I don't want this to cause a lot of pain, okay? So remember, with these videos, you are always in control. So if this doesn't feel right, if it's causing more pain or discomfort for you, give yourself permission to stop. You are in control of that. However, if you're doing okay with this, what you're going to do is try to hold here for about 3 to 5 minutes, just lengthening and opening. As your body softens and the myofascial release happens, you'll notice that maybe you could open a little bit more, okay? So you're going to do that straight up. And then what I would recommend is tilt left ear towards your left shoulder while you're looking up. And this is going to give you a little more release into the front side on the right side. So again, you're going to feel this into your jaw and down. You might even feel it even down into your chest or down into your abdomen, and that's perfectly fine, okay? So what I would recommend with the myofascial release is take your time, hold for a minimum of 3 minutes, because it takes that long for the fascia or connective tissue to actually release. So we are doing these releases that go beyond just muscle stretching. It's really going to give you more permanent results. It's also going to give you more permanent relief of your symptoms, okay, or more longer lasting relief. And then try it to the right side to open up the left. So that's release number 1. For the second myofascial release, what you're going to need is a foam roller or 1 or 2 bath towels. Now, I like this smart roller because it doesn't roll away from me. It's a little more sturdy and it's softer than a traditional foam roller, but use what you have at home if you can lie down on the foam roller and it's not too firm for you. I will say if you do have osteoporosis or if you have some balance issues, please use caution with this. And in that case, I would actually recommend that you use a bath towel. So I'm going to use the foam roller here in a little bit, but I'll show you. This is 2 bath towels folded and then rolled together. I like the bath towel for certain times because it's going to be a lot softer and it's not going to roll away. So if you try the foam roller and it's not working really well, or if you automatically know by watching this video that the towel might be better for you, go ahead and try that instead. I'm going to put that to the side. Now what I'm going to do is take this foam roller and I'm just going to place it down here. What we're going to do is lie on top of it. Okay, so you want to position yourself. I'm going to sit here on the end and I'm going to lie back. So I'm positioning myself so this is along my spine, but you can see how I'm actually positioning it so my head is not supported. And I'm doing that for a reason, because now you can see that I'm just using gravity and strategic positioning in order to allow this to open up in the front of my neck. Okay, so you can stay here and just let gravity do its work. I'm going to give you some extra tips. One is you might want to bring hands out to the side into like a T position. This is going to help to open up into the front of my chest where those muscles might be tight and pulling the front of the neck. Okay, so that adds a little bit to it. Another variation you could do is combining this one with that first tip I gave you. So I could take my hands, place them right underneath my collarbone, one hand and then the other, and I can provide a little bit extra release here by anchoring my hands down and then very gently bringing them down towards my pubic bone or my stomach without sliding on the surface of my skin. That's going to allow more release in through here. Okay. Another tip I want to give you, going back to whatever you found at the wall. If you can't stand next to the wall without your head being in contact, like it's forward, this is probably going to be too much for you. So the other tips I have is, in that case, use your towel. One towel might be sufficient. Maybe you have to even position it like, yeah, just one towel, or maybe you need a little bit more than that. You could even use a towel and a half and just leave this end open, but you get to decide how tall that towel is. It's also possible that I do something like this. I'm just giving you all my little tricks. I can place this here and I can lie back like so that I get a good stretch. However, this is going to give me a little extra support. Okay, so I'm not quite as far down as if I'm here. Okay, so I'm going to encourage you to play around with that a little bit. Find out what your body needs. Find out where you can feel that mild to medium stretch, but don't cause yourself a lot of pain and listen to your body with that. Remember, when we do myofascial releases, I recommend holding for 3 to 5 minutes. And you might notice sometimes that things get a little stirred up before they start to feel better. And that is part of, at times, that's part of a good myofascial release. If you have any questions, you can certainly reach out to me. I'm happy to answer your questions and guide you a little bit more. So you can leave a comment below on this YouTube video. That's a good place to ask questions. However, the best place is actually to head to our website, healingspotpt.com, and pick whatever option works out the best for you. If you'd like to talk to a member of our team and get any of your questions or concerns answered, we would be happy to do a phone consultation with you. You could even, if you're local here to Colorado Springs, you can meet with one of our therapists and get some more guidance on myofascial release and pain relief for headaches, neck pain, and migraines. And before we wrap up, don't forget to subscribe to our YouTube channel and look around our Ed Talk playlist. There's a lot of videos that help you at home in order to have more education, have more tools to help yourself feel better and move more easy and be confident in life. Thank you so much for watching this Ed Talk. We'll see you on the next one.